Women will have many different symptoms depending on the type of incontinence they have. Some women will leak when they have coughing or sneezing, sometimes with physical activity like walking or running. Some women will have frequency of urination, or they'll get up at night to go to the bathroom. Some people experience urgency where they have to get to the bathroom right away, gotta go right now. It's different for every person. Having children can definitely cause urinary incontinence. Just being pregnant, even having a C-section, there are women who have C-sections who have urinary incontinence as well. Constipation, urinary tract infections, any type of medical problem that involves your nerve tissue. Sometimes women with back pain can also have problems with incontinence because that affects the nerves that control the bladder and the bowel. It's estimated that about 1 in 4 young women have urinary incontinence, and as you age, it gets more common with time. Older women like 65 and older, may have 3 out of 4 women who have incontinence, so 75%. There's a lot of people out there too who they don't come in and ask for help because they just think it's part of the aging process. There's a lot of different options that we have at our Pelvic Health Clinic. It can be very conservative measures, dietary changes, what you're eating and drinking can affect leakage. You can try physical therapy and just strengthening your pelvic floor. Sometimes there are pessaries that can help with incontinence. Those are devices that go inside the vagina to hold things in place. They also can help prevent leakage. Surgeries are also an option for some people. It just depends on what type of leakage you have. People will often come to see me first, and I'll do an initial visit with patients when they first come in. We'll discuss the symptoms that you have, what bothers you the most, what is really influencing your life, how it affects your life. We'll do a thorough exam and an evaluation based on your symptoms and also your medical history. And then based on those things, I'll give you recommendations as to what your options are for treatment. We really try to look at the whole person, see what else is going on. There's a lot of other things that can be going on that you may not even know about that are related to incontinence. Some women have painful intercourse. Some women will have prolapse, which is where there's a bulge in the vagina. And those things are often very common with incontinence. Everybody has a different set of circumstances in their life. They have different medical problems. They have different things going on in life. So what's right for one person may not be right for another patient. We really look at what kind of health problems they have, realistic expectations for the treatments that are available, and then we decide together as to what the best option might be. And really it's the patient's decision in the end based on what's appropriate. It can change things fairly dramatically for some patients. One of my favorite things is when people come back to the clinic and they tell me they don't have to look for a bathroom every time they go out, and they don't need to take a change of clothes anymore, or maybe they can make it to the bathroom at night when they get up to go to the bathroom. So for some people it's a pretty dramatic change. Sometimes it's just enough to make you feel more comfortable with yourself. Sometimes we have to try multiple things, but we really try hard to make things better for people. That's why we all started doing this. One thing that I would love women everywhere to know is that urinary incontinence is very common. There's a lot of women out there who don't feel comfortable talking about it. They don't want to talk about it, and so they don't do anything about it. But please know that you can come and get help. We try to do what's right for you. We're not going to force a treatment on you. It's really your decision in the end. So please come in.